All right, welcome everyone. My name is Dana Howarth. I'm the Deputy Director of the New Mexico Caregivers Coalition. We're so glad to have you joining us on this Wednesday afternoon. Today's session is on history of home and community-based services with a guest speaker. But before I pass it on to our guest speaker, just some quick housekeeping. Most of you probably already heard Valerie asking for names. So if you haven't already, make sure we know who you are so we can mark you on our attendance list. If at any time during today's class you have questions or anything, you're welcome to either put them in the chat or there's also a raise hand button. It's under the reactions. It's like a smiley face that says reactions, and one of those is raise hand. That'll alert our presenter that someone wants to speak and ask a question. So either option, whichever you're most comfortable with, either raising your hand or writing it in the chat, that is your option. We ask that everyone during the session stays on mute, on the mute for your microphone. Sometimes a lot of background noise picks up on the recording and we try to limit that. If anyone needs help with that, feel free to reach out to Valerie or Bridget in the chat, and one of them can try to help you instruct on how to find the mute button. All right, so a quick introduction of our presenter. Today's guest presenter is Pamela Stafford. She's the younger sibling of an individual with developmental disabilities. She was involved in the DD service provision in New Mexico for 26 years before joining New Mexico Caregivers in Action as the organizing director, and she has a master's in American Studies with an academic emphasis in multiculturalism. So handing it over to Pamela Stafford.
Thank you, Dana, and thank you everyone for attending. I am so appreciative of the New Mexico Caregivers Coalition for inviting me today. This is a topic that I have a great deal of interest in. And so I love talking about it. I love talking to people about it. I am going to share my screen for a PowerPoint. And so today's topic is history of home and community-based services. And I want to begin by talking about the reason why I developed this presentation and the reason why I requested that the Caregivers Coalition invite me to present it. As I have been doing some training on behalf of the coalition for the last year, it strikes me that many people who are providing supports under home and community-based services didn't really understand how new home and community-based services was, less than 50 years old. So as we talk about changes in the service provision, it was interesting that people didn't realize that it was such a new field, that really there's a lot of changes because we're learning about it. The other thing is that we're hearing a lot in the news about the care economy. You might have heard people talk about how we need better funding and support for our care economy. But it doesn't seem like there's a lot of people talking about the fact that the reason we need it now is because of some differences in the way things were 50 years ago and the way they were 100 years ago. And so it just seems like asking for more money for services without understanding where we're at kind of an historical framework right now. Also, up until a couple of years ago, I wasn't really connected with the fact that home health aides and direct support staff were really considered domestic workers. When I entered the field, I knew that we were moving from kind of a medical model of treatment to a more social model. But it wasn't until a couple of years ago, really trying to work with the coalition around some advocacy for legislation, that I began to understand the connection between the two. And now it makes a little more sense to me. And I think Chenda, who's in our audience today, gave the best example last week when she said, a domestic worker, a home house cleaner, for instance, may be someone who prepares meals. A home health aide may prepare meals, but they may have to do it with the special dietary needs or to prepare it in such a way as that to prevent aspiration. And that's moving a little more towards healthcare and medical model. But the medical services really wants to make a distinction between home healthcare workers and nurses or CNAs, and that's because of licensing and delegation reasons. But so it makes sense then that there's this hybrid area that we haven't had before, before the last 50 years, and that it has found a home within domestic workers. And the National Domestic Workers Alliance has been working really hard in the last year to try and increase funding for caregivers. Some of the people in the audience today have been attending a training that the coalition has put on that was developed by the National Domestic Workers Alliance. That is called We Make History, and it's about the history of the workforce that includes domestic workers, house cleaners, nannies, and caregivers. And it's a great training. They graduate tomorrow after a 9-month training. Yay-hoo! But within that training, it seemed to me that maybe perhaps what was left out is the fact that a lot of advocacy on behalf of caregivers that caregivers have done have not been so much about their own worker advocacy, but on behalf of the people they take care of. And so I thought it would be good to kind of make sure that we were including that as we talk about the history of caregiver and the workforce. So there is resource material that I used to develop this. This is a list of some of the major resources that I used in developing this presentation. There are some limits within this training since it's just an hour and a half. I wanted to provide the information in a simple and clear way. But I also recognize that throughout history, the experience of people vary, and they depend on a variety of factors, including race, economics, gender, culture, religious beliefs. And so the limitation of this training is that while I've tried to be inclusive of information on disability and our valued elders, there is not sufficient time to discuss in full details the differences in experience of different groups. So as I'm saying, this happened in the 50s or this happened in the 60s, it might not be exactly what happened or was going on within your specific community. And yet, I think the training is important to be as clear and simple as possible in the way that it's organized. And so I want to start now with opening reflections, which I always try to include in any training that I do. And I want us to think about the fact that because this is a history class, we're kind of looking in the rear view mirror. And I imagine that we're all different ages in this class. So I want you all to think back to when you were a child. And if you had either family members or friends who were elderly or disabled, I want you to put in the chat what kind of in-home supports do you remember seeing and who were the caregivers. And while you do that, I will talk a little bit about my experience as the younger sibling of a person with developmental disabilities. She was born in the 50s, so she did not attend school. And it was suggested to my parents that she be placed in an institution. They decided not to do that. But we didn't have any support or any help, nobody coming into our home. And we were not a family that visited doctors or professionals very often. And so the caregiver was really my mom and maybe my oldest sibling a little bit, and to some degree. And so I can't see the chat without stopping my share. Did anybody want to include in the chat anything they remember about being a child when it comes to caregiving, seeing someone take care of their parents or their grandparents or a person with disabilities? Who were the caregivers? Mom cared for her dad, aunties and uncles. Okay. Maternal grandmother was in need of care. My mother was the primary caregiver along with my aunts. Mom for her mom. And so that's kind of the history, right? Is that it's family caring for families most often. Oh, it didn't have me start from the beginning. Here we go. So we're going to be talking through the timeline for our history. We're also going to be talking about our ancestors in terms of advocates. There is one of the resources that I put on the other slide was Parallels in Time, and it goes back all the way to BC to talk about people with developmental disabilities. I didn't think I could go back that long, so we're going back 200 years. So let's go back to 1822. In 1822, people were living shorter lives, and persons with significant disabilities lived much shorter lives, sometimes only a matter of years. Most people were living in agricultural or agrarian society where communities tended to take care of each other. A barter system was still considered legitimate economics. So rather than paying with money, sometimes you would bring fruits or vegetables or a cloth or a blanket that you made and exchange things in that way. And one example of this is that in smaller communities, women who say their husband was dead, they might receive assistance with tending to their fields from other males, but they might mend clothes or make meals for people without wives. There is evidence in the research that able-bodied individuals with cognitive disabilities would be included in these arrangements. But those who needed more intense care would seldom go to hospitals or facilities. They would be cared for at home, either by servants, including by slaves, or for those with means, or by family members. And also during this time, people often lived with their extended families. They had their parents, grandparents, cousins, aunts, and cousins, either in the same household or very close by. So if we move ahead, say about 50 years to about 1870, we are in the midst of what is called the industrial age, where we're making more things in factories rather than growing food. And so there's 4 things that happened during the industrial age, which significantly impacted the way in which we as a society provide care. One is just that there was this major shift in our economy, and that because of that, people moved to the cities. And so more and more people started living in a city. And it's interesting to me that you can be in a town of 500 people and you probably know all 500 people. But if you move to a city of 500,000, you may not know 500 people. It's just a different mentality when you're from a smaller community than when you're from a city or an urban community. And that changed the way we provided care. With technological advancements came not only industrialization advancements, but also advancements in health treatments. And that allowed people to live longer and with the more significant impact of disability. So more people needed care. And then people often don't move to cities with extended family. When they were moving to the cities, they were moving with perhaps the older son would stay on the farm and the younger son would move to the city with his wife and his children. And that became really a focus on what we now call the nuclear family, which is 2 parents and kids, and not so much grandparents or cousins or aunts or uncles. And that has become, when we talk about many of the things and we focus on the family, we're talking about a nuclear family, but that concept really wasn't very strong in our society until about 1870. Also during this time, if people couldn't afford to live in the city, they lost their job or they ran into financial trouble, then as now, they often went to shelters, and these were called poorhouses and almshouses. But they were often places of high crime, and so much like they are now, so vulnerable people were easily harmed. So advocates for the disabled, such as Dorothea Dix and Samuel Howe, began to lobby Congress to put aside lands and funds to house people with disabilities away from the society for their protection. And ironically, these were often outside of the city on farms. So people who had moved into the city were now, because they couldn't afford to live or work in the city, were now being put into farms. And the ideal, though, was that they would learn skills and then return to their community. And during this time, even though this led to the institutionalization of people with disabilities, during this specific time, there was legitimate advancements in training people with cognitive disabilities, the visually impaired, and the deaf to learn new skills. Meanwhile, other charitable organizations began to open homes for some elderly who were not able to work. So let's go into some timeline specifics with that. In 1817, the Indigent Widow and Single Women's Society for poor and elderly women who had lost their husband or who were single began organizing and raising funds. It's important to remember that women in the 1870 weren't allowed to own property and very seldom worked. And so if you didn't have a husband, you were very often poor. In 1848, the Massachusetts School for Idiotic and Feeble-Minded Youth was established. That was the first training school of its kind in this country. And at the time, most people believed that persons with cognitive disabilities could not be taught. And so landmark instrumental school in really demonstrating that persons could be taught. In 1862, Civil War pensioners became the first major pension program in the country. And this was for Union soldiers who were disabled, but it also allowed their spouses and their dependents to draw on pensions. And so that kind of began the pension system within our country. And then there really were not nursing homes. There were old age homes, and they had between 30 and 50 beds. For a modest fee, a resident would get a roof and daily meals as long as they could make their own bed and come down for breakfast each morning. So in a way, that's more of what we would consider today to be a boarding home model than a nursing home model. As we move into the early 20th century, we see within the disabled a proliferation of institutions. There were institutions just sprouting up everywhere. And there was a philosophical shift. Remember that initially institutions had been set up, training schools had been set up to protect persons with disabilities from the community. But in the early 20th century, that shifted to protect society from persons with disabilities. And that was because of an eugenics movement, which was the belief that persons with disabilities were disabled due to bad genes. The eugenics movement was very strong in both Europe and the United States. It kind of culminated in Nazi Germany with the camps that ended up killing people who were Jewish, but also people who were gay and also people who were disabled. And it more or less ended the eugenics movement in the United States. But before World War II, the eugenics movement was a major movement within the United States. And so institutions who were really, again, set up at this time to protect society from these bad people, they were overcrowded and had conditions with ill treatment. For the elderly, 1909 was the first home healthcare insurance policy with MetLife, which would allow nursing visits at home. From 1900 to 1930, the lifespan increased by 10 years each decade. So from 1900 to 1930s, you would live 30 years longer than you would in 1899. That was the largest lifespan increase in a short period of time ever. And why it's wonderful that people are living longer, it also created this idea for the first time that people wouldn't necessarily just get sick and die. They would become old, maybe without significant medical disease. And yet just becoming old meant that you would slow down, that maybe you move slower, and maybe you wouldn't be able to work. And so it sounds kind of odd to think about, but until people were living long enough to know that, we didn't realize that that aging meant that people couldn't work. And so that became a social issue because people became concerned about what are you going to do for people, most people who had not put enough savings away to support themselves when they couldn't work. So in 1930, the Depression hit. I think we all know enough about the Depression era that I don't have to explain what it is, but it had consequences on the care community. More than half of all senior citizens were thrown into poverty. And poor houses, those houses that existed for people that couldn't survive economically in the city, they were overwhelmed with people trying to live in these shelters. When families were no longer able to provide care at home because maybe they had lost their home or they were often hobos would travel trying to get work and to send money back home, then the elderly went into hospitals. And what hospitals, who were accustomed to people come to get born, people come to die, or they come to get better, what they realized for the first time is that providing kind of long-term care for 10 to 20 years for people who were not going to get better, but didn't really need nursing services was going to be really expensive. And they started to advocate for the government to find other alternatives outside of people coming to hospitals. So in 1935, less than 100 years ago, the Social Security Act was passed. And that was the first federal program for the elderly It was not universal, but it was based on need. But it became the foundation for what we now think of as our Social Security. What that allowed is for these boarding home type places that had been providing elder care to become actual nursing homes, because Social Security money could go directly to those homes, but only if nursing needs were taken care of. And so it really was in the 30s that the concept of a nursing home became something that was widespread and something that people were seeing. And so here's our first advocate of the training, the professional Lillian Wald. She was a nurse and activist for many causes. In 1893, she started a home class on nursing for poor immigrant families in New York City. She coined the term public health nurse. She established nursing insurance partnerships with MetLife. She founded the Henry Street Settlement, which became the first visiting nurse service in the country. She was involved in the women's trade movement in 1903, and she was a founding member of the NAACP. Without her, it is possible the concept of home health care would not exist. She wanted to find a way to provide health services to lower income immigrant families who otherwise would not have received health care. So now let's move a little closer, 1930 to 1950. And in those 20 years, we saw new causes of disability. So we saw more people with disability. That included the soldiers from 2 world wars. It also included greater industrial accidents, people who were working in industries where there wasn't safe practices. Polio created a lot of disabilities as well as other diseases. So again, that impacted the care economy of that time. The other thing that had happened is that women had entered the workforce during World War II because they had to. There weren't enough men here to do that work. But not every woman was excited to leave the workforce once World War II was over. And so the fact that women had gotten used to working and had proven that they could work also impacted our care economy, since most people who are part of taking care of families at home, think back to what we said in our chat, our moms, our aunties, our grandmothers. So families with elder care needs really began to debate on whether or not the elderly would be better cared for in long-term care facilities, or whether or not they should be cared at home by family members. So think about that. Up until 1935, there were no options to send people to a nursing home. And many families did just that because economically they had no choice. Now in the 1950s, people have, the economy is prospering. People have more options, but now they also have the option to choose if their valued elder should go to a nursing home or if they should be cared for at home, what was best for the elder, what was best for the family members. And that's a debate that started at that time that I think that families still have today. So nursing homes increased significantly in the 1950s. That's just like there was a large increase of institutions in the 1910s, 1920s. Nursing homes had that same kind of large, significant increase in the 1950s. Meanwhile, parents whose children had cognitive disabilities were being told by doctors to put their children in institutions, such as my parents had been told. But some parents began to want to care for their children at home. And so let's talk a little bit about then the parents. In the 1950s, families across the country formed small groups in their Oh, I went back too far. There we go. In 1950s, families across the country formed small groups in their communities as they struggled to care for their children with disabilities. What would happen is that you would have a group of maybe 3 parents ask their church for a basement. And then one parent would take care of all the children with disabilities for that group for one day. And then the next day would be another parent. And then the next day would be another parent. We remember children with disabilities weren't allowed to go to daycares at the time. And so that's kind of was how parents were able to begin to make sure that their kids had some socialization and some friendships, but also how they could take care of the needs that maybe their other children have, or maybe they could work a part-time job. But they began to be really insistent that services had to be available at their homes and in the community and not just in an institutional setting. And I want to play a very small clip. I may have to stop and make sure that I'm sharing my sound because I think there's something special I have to click. So if you can't hear it.
Like millions of other unfortunate Americans, I am the parent of a mentally retarded child. In this county, we have no special classes, no nursery schools, no community or child guidance centers to give our children what parents of every normal child take for granted. If you have such a child yourself or are interested in this problem, you're welcome to attend a meeting at 8 o'clock Thursday evening at the home of Mrs. John Wheeler.
And so that's one example of, oh, I'm still playing apparently, hang on. A little bit of graduation music there for people. And so that's one example of how these families group formed. Is you would have 2 or 3 families getting together, and then they would start to do ads or radio announcements, trying to get other people to join with them. So moving into the 1960s, these parent advocacy groups from across the country started to hear about each other. And so they formed into the ARC-US. And so the ARC-US now has a state chapter in every state, at least one international chapter, and then many local chapters. In New Mexico, there's the ARC New Mexico, but there's also the ARC of San Juan up in San Juan County. And so with the ARC-US and other movements, other organizations such as the United Cerebral Palsy Association and Muscular Dystrophy Association, they became a really strong voice on behalf of people with developmental disabilities. In 1962, there was a presidential panel of mental retardation called, which asked for recommendations to be made both to improve the conditions in institutions, but also on how to improve community services, those for hard to provide services really, for those parents who wanted to provide, that wanted to keep their children with them at home. In 1965, Medicare and Medicaid are signed into law. So that hasn't been very long. Within my lifetime, 1965, Medicare and Medicaid are signed into law. In 1966, there was a publication called Christmas in Purgatory, which published pictures and a person had snuck in. They were working and had snuck a camera in their pocket to take pictures of people in institutions. And the pictures were pretty shocking and amazing at the condition people were living in. In 1968, Senator Robert Kennedy began visiting institutions to see exactly what was happening in those institutions. And also that same year, because there were concerns about nursing homes, government began to really begin some oversight of nursing homes. So we had talked about parents. Let's talk a little bit about siblings. When we talk about the 60s, many changes for individuals with cognitive disabilities occurred in the 60s because we had a strong political family who wanted those changes to be made. President John Kennedy, Senator Robert Kennedy, and Eunice Kennedy Shriver. And they fought for those changes to honor their sister Rosemary. And so Rosemary Kennedy was born in 1918. What was happening in 1918, a little over 100 years ago, was that there was a pandemic, if you can imagine, a Spanish flu pandemic. And that meant that there was a shortage of doctors. So when Rose Kennedy went into labor, there was not a doctor who could help to deliver the baby. And so for over 2 hours, a nurse held the baby in the birth canal to keep the baby from coming out without a doctor in place. And so what that caused was some developmental disabilities. She was a very active social child who was even presented when her father, Joe Kennedy, was ambassador to England. She was presented at the court of Queen Elizabeth with her sister. And all the reports from that time, all the journalists who wrote about it, admire her and said great things about how charming she was. But in an attempt to cure her of her developmental disabilities, her father gave access for her to have an experimental lobotomy, which left her unable to walk or to talk. And she spent the remainder of her years, she died this century, so at least 60 years in an institutional setting, not really an institution in that it was private pay. And so it was a nicer setting. Joe Kennedy didn't tell either his wife or his other children about the surgery. What he told them was that she was placed in a training school that was helping her to learn, and that she was really happy and that she was really prospering, but that it would be best if no one visited, because that would disrupt her, and that was the recommendations of the doctors. And it wasn't until John Kennedy was in politics in 1958 that he went to visit her and realized and was told about the lobotomy that she had had. And he, of course, was shocked by how different she was than the sister he had known. But we have, in many ways, the Medicaid waiver programs, in many ways, Special Olympics, very special arts programs can all be attributed to the influence of Rosemary Kennedy. In the 1970s, the paths for persons with disabilities and the elderly were really going along. They did not converge. They were really going along kind of similar paths. So there were attempts to improve oversight and conditions both in the institutions and in nursing homes. And these occurred through greater regulations and through lawsuits. There was also the independent living movement for persons with disabilities and the determination to push services from the Division of Vocational Rehabilitation to allow work. The Division of Vocational Rehabilitation had been set up in the 30s really to help returning veterans. But in the 70s, they were very much marking people as unemployable who had significant disabilities, especially those who were born with disabilities. And so the independent living movement was having no part of that and really pushed for the division of vocational rehabilitation to allow more work. And there were major changes to the laws affecting DVR because of this movement. The Gray Panthers fought against mandatory retirement laws. They were being told they would have to retire by 65. And some of us would love to retire about 65 and don't think we can. But in the 70s, people who wanted to work longer were being told that they had to retire. And then the other thing that was created in the 70s were assisted living facilities, because some elderlies who didn't want to go to nursing homes, but they weren't able to live independently. That allowed for greater independence, but still to have some care. So here is Maggie Kuhn, our Gray Panther. In 1970, at the age of 65, she was forced to retire due to a mandatory retirement age. She founded the Gray Panthers to fight for the end of discriminatory practices for the elderly. The organization opposed President Reagan's proposed cuts to Medicare and Social Security and was successful in keeping the deep cuts that he had proposed from occurring. So far, we're talking about the history that led up to the development of home and community-based services, but we haven't yet talked about home and community-based services being created yet by law. And so I'm wondering if people would put in the chat either the year you think or guess, if you don't know, that home and community-based services were created. We're done with the 70s, 1980, 80s. So that's 42 years ago. That's pretty recent, really, when you think about it. In 1981, as part of the Budget Reconciliation Act, and people probably hear about those today. That's when, rather than passing smaller bills, you have the Senate and the House kind of get together and decide what goes into a budget. As part of that, there was an amendment to the Social Security Act, and that created the 1915C waivers, which are the waivers when we talk about MVIA waiver and support waivers and Medicaid waivers. Those are all under the 1915C section of the Social Security Act. Prior to the creation of home and community-based services waivers, long-term care was available through Medicaid only in institutional settings. So the creation of waivers allowed for state plans to provide non-medical services, excluding room and board, which has to be paid separately. But that basically Medicaid said, look, if you as a state want to ask for a waiver saying that a person with a disability or who can't live independently gets a hospital bed or an institutional room, in order to allow people to live in the community, you can ask and request that. But even though that was created in 1981, states were very slow to adopt the creation of waivers as part of their state plans. They didn't jump on the bandwagon on this at all. New Mexico came a little earlier because of the Jackson class lawsuit. So here are some advocates, Katie and Julie Beckett. Katie Beckett was born in 1978 and contracted viral encephalitis, a serious infection that causes inflammation of the brain. She contracted that when she was 6 months old, and she spent the next 3.5 years in the hospital. When her family insurance was exhausted, Medicaid paid the hospital bills, but Medicaid would not cover care that was provided at home. And all the research and cost estimates showed that while her hospital care was about $12,000 per month, if they could provide the care at home, those costs would drop to about $2,000 per month. And that they would use home health nurses to help with that care. So Katie's mother, Julie, contacted her local representative, and the Katie Beckett waiver was created shortly after by President Reagan. And that established a veteran program that allowed individuals with disabilities to receive health care at their home or in their community. And this went on to be the basis for what we now know as home and community-based services. So in the middle, you have a picture of a young Julie and even baby Katie. On the side with the young woman, that is Katie. Katie ended up graduating college and became a patient advocate in hospitals. She died in 2012 at the age of 33, which was about 30 years longer than medical professionals had thought she would live. So getting out of the hospital was a good thing. Julie Beckett, her mother, is the woman on the other side, who went on to spend a lifetime in work and advocacy for people with disabilities and died last Friday. So in the 90s, the Americans with Disabilities Act was passed, and no one expected it, and that's landmark legislation. I don't mean to gloss over it. It was a landmark legislation with huge amount of advocacy around it. But no one expected that it would have such an impact on home and community-based services. And the reason it did is because in 1999, the Supreme Court ruled in the Homestead decision that the unnecessary institutionalization due to a lack of other options is a violation of the 1990 Americans with Disabilities Act. So in the 80s, the option that states had was to ask to put in a Medicaid waiver that would allow people to not be institutionalized. And a lot of states decided not to do that. Then in 1990, the ADA is passed. And in 1999, the Supreme Court said, states, you don't have a choice any longer. If you are institutionalizing people because you don't have any other options, you are violating their civil rights. And so I want to show a brief video that explains that a little better, because you probably are all sick to death of my voice. But again, I think I have to stop sharing. And remember that when I share, to press the sound.
Activists in the independent living movement organized to demand an end to segregation for Americans with disabilities, who were denied basic rights like attending schools, holding jobs, or choosing homes. This led to a major milestone with the U.S. Supreme Court's Olmstead decision. Like Brown versus Board of Education, the decision that ended racial segregation in public schools, Olmstead affirmed the idea that nobody can be separated from society and denied the right to make decisions for themselves. But it wasn't always this way. For decades, Americans with disabilities were largely housed in facilities, like nursing homes, psychiatric hospitals, or in developmental disability institutions, where residents had to follow rules about things like when and what they could eat, when they could go outside, and even who they were allowed to date or marry. Society had an institutional bias, leaving few alternatives for people with disabilities. Disability activists fought back by organizing. From the 1960s to the 80s, activists staged protests and demonstrations, cases moved through the courts, and new legislation was passed, expanding access to housing, education, employment, and healthcare. Finally, a sweeping civil rights bill known as the Americans with Disabilities Act passed in 1990. Despite this progress, there were still gaps. People with disabilities could still be institutionalized. Then, in 1999, the case of Olmstead versus Lois Curtis and Elaine Wilson was brought before the Supreme Court. In the Olmstead decision, the court concluded that people with disabilities have a right to receive state-funded supports in the community, rather than in facilities, affirming the argument that had been made by advocates for decades. Having these choices isn't more expensive. In fact, it costs less. In 2009, the National Council on Disability found the annual cost of institutional care was more than community-based supports in every state. $188,000 per person in a facility versus only about $42,000 for comparable services in the community. Later, cases based on Olmstead pushed states to create plans to reduce their institutionalized populations. Yet, progress has been slow. According to the last US Census in 2010, over 2 million people were housed in some kind of facility. But community living isn't just a preference, it's a civil right. That's the legacy of the Olmstead decision. You have the right to choose your community and the right to access supports you may need in your home, rather than in a facility. For more information in Washington State, contact Disability Rights Washington.
Okay. So I thought that was a good summary. So specifically, waiver programs called for case manager, homemaker services, home health care aides, personal care, and adult rehabilitation services. That brings us to today. And so today we have self-directed movements. We have things like the MFIA waiver, where individuals are able to hire their own staff, their own supports, and decide how the money that's allocated to their budgets is able to be spent. We have moved to more of a social model away from the medical model. And that language, social versus medical model, comes from the idea from disability advocates that it is not their disability that is the most, that makes it the hardest for them to access things in the community. It's more of the barriers to either like not having ramps or attitudinal barriers that prevent them from being part of society, discrimination, institutional bias, and that if we really focused on becoming a more inclusive society, then the fact that they were medical reasons for disabilities would no longer matter. And so we're really moving more towards a social model and person-centered approaches to services designed for persons with developmental disabilities. 14 states have eliminated large institutions. I would say only 14 states have eliminated large institutions. New Mexico is one of them. And the 35-year lawsuit, Jackson class lawsuit, which closed down the institution, was closed last month. It has ended after 35 years. There's a long wait list for services in the majority of states. Here in New Mexico, there are efforts to move everyone off the wait list in the next 2 to 3 years. But the fight for true equality is far from over. For the elderly, I thought this was a shocking statistic. Since 2008, the largest growth in the homeless population has been single women over 65. Used to be veterans. Now it's single women over 65. So that's pretty shocking, I think. There's not as many jobs anymore which offer pensions. And Social Security is set up for at a poverty level. And so many seniors who are able to live independently still live in poverty. Home health care aides are underpaid, not reimbursed really for travel that they may do between clients, patients. And many care recipients, many people who receive care, report challenges in recruiting and retaining aides, and that keeps them from being able to provide, to have the services, being able to be active in their communities. So now let's talk about some current people making history. Self-advocates, family, and caregivers. On the left-hand side, the first pic is a pic that I had permission to share from the ARC New Mexico. It is a group of self-advocates, family members who are in DC to meet with their congressmen. This was in, I believe, 2018, maybe 2019, to talk about things like Medicaid funding, more money so that people could get off the wait list, and also improvements to Social Security, things like eliminating the Social Security marriage tax, which means that if you're a married couple and both of you earn Social Security, you earn less because you got married. And then you see the film crew, because they were part of the ARC-US was doing a film crew of a film about advocates who had came to the Capitol to talk about those things. In the second pic, you have New Mexico caregivers and also some Arizona caregivers. And I think there's some people in that picture who are in our audience today, marching for Build Back Better and trying to get better paid. And then I am going to show a video from last week. I think my sound is still active. And this is a video of Valerie. My sound's active, but it's not active.
Good morning, family, caregivers, advocates, and leaders. It is an honor I don't take lightly to be asked to speak today. My name is Valerie Sosi, and I'm a member of the Navajo Nation tribe and the president and founder of the Sotso Foundation, a member of the New Mexico Caregiver Association. I have worked with caregivers on the Navajo Reservation for more than 10 years. A few years ago, I found out that my mother was sick with stage 3 cancer. I'd always told the caregivers that I work with that they are not alone. But when I was caring for my mom, it was hard to take my own advice. I really did feel like I was alone. It was so hard to provide her with the care she needed while juggling my own full-time job. As a caregiver, you get so little training from the doctors and the hospitals about how to safely care for your loved one. For example, how to transfer them from a wheelchair to their bed without hurting yourself. I was working full-time and caring for my mom on top of my responsibilities at work. My mom got more and more sick. As the cancer progressed, she had a stroke and then a heart attack. After the stroke, it became impossible for me to continue to work. I ran out of paid family leave, and my employer was not supportive of my leave. There are thousands of caregivers just like me on the Navajo Reservation. We need more support. We need additional resources and training to ensure that we are taking care of ourselves and loved ones safely and with the dignity we deserve. For those who are paid caregivers, we need protection from harassment and retaliation, better wages,
Somewhere I got way up there. And so those are just some of the people making history today in terms of trying to advocate, both for their family members, as you see with some of the parents from the Arc of New Mexico, for themselves, as you see the self-advocates, and then family members and professional caregivers in DC. So I wanted to make sure we had plenty of time for questions, but I also want to do an ending reflection. We looked at this view today mostly as a look at the past through the rear view window. But there's a future road ahead for us. And so I'm wondering if people would either put into chat, or I think we have time to come off of mute if a couple of people wanted to raise their hands and do so. What do you see as the road ahead for home and community-based services?
Well, Pam, may I say something?
Please.
Well, you know what, to be honest with you, we're gonna broke, the country, because we spend lots of money helping out, taxpayer. I don't resent that, my daughter got services too, but I'd like to see more recipient, those participants involved in inclusion, coming out in the community, finding job, and really do a lot of self-help and self-care instead of giving the responsibility to the government, to somebody else to take care of them. I mean, that include family members, caregivers that try to care for them, but they need to have the mindset that our country will be broke if we're not doing anything like to help yourself, because being a support group leadership around this area, I try to get lots of family. And once they're on the waiver program, they totally drop out. They have nothing to do with it. They just want to keep the money and keep it themselves instead of give it to the participants. And which is, I am very angry. Some of the family that I saw that they literally live off their disabled participants, that's not fair. And then being an advocate, I have to speak up. And I can't help it, babe. I'm not here to be somebody lovers, So like I said, we really need to get involved and get people more educated, and so they can help themselves.
Okay, thank you for that. And then I don't know if it's Constance or Constines, so I hope I'm not mispronouncing your name. Says, I think it would be very beneficial for this issue to be made more aware of. Family will and should ultimately be the caregivers for their elderly and I'm having some problems moving and seeing the messages.
Private funding and agreed upon matrix.
Okay, would you read the other ones?
That was the one you read, right?
Yeah, that's the one I think I was. Oh no, that's is that the one I was in the midst of reading?
I think you mixed up the first and second one that she had. So
Okay.
That first one I can go ahead and read for you. I think
Yeah,
it'd be very beneficial for this issue to be made more aware of. Family will and should ultimately be the caregivers for the elderly and disabled. Resources and classes are extremely needed. And then you read the other side. They need to be professionalized in professional wages, benefits, appropriate credentials, oversight, public and private funding with agreed upon matrix. There we go.
Yep. So that was coming home. Who else? Anybody else have a comment about a direction they would like to see home and community-based services go?
The same. Pam, I just like to share that we went to DC again recently, which is where you heard the speech that I made, but we met with 3 representatives with New Mexico as well as Arizona Representative Cinema. And I'm so happy to say that we got a yes for support for what Coming Home Connections is talking about. Having those wages and benefits, because we know that if you are a paid professional, you're not even getting minimum wage most of the time. So I'm so excited to be working with the New Mexico Caregiver Coalition and Pam and getting those yeses for this upcoming bill. But with election season coming around, I would really love to say that you have the vote. Cinema claims to be a Democrat, and she's not supporting Democratic issues such as this. So when you vote, this is the time to show up and show out. And hopefully this wonderful presentation that Pam has given gives you that insight of, you know, the things that we need here for caregivers. It's very important. Navajo, again, is located in 4 states. I don't know what state you vote in, but we need you out there, and let us know, you know, let them know and help get the word out there. Part of education is you talking about it. If you're not going to the chapter house, you know, that's okay. But I think even talking with your family members, because a lot of people, the assumption is that when they say caregiver and then they're getting a paid caregiver, that it's like a normal job, that you get leave, you get medical, dental, retirement, and it's a regular job. But when you get into that field, it's not. And you find out all of these things, I always say injustices, that you're not getting paid, because a lot of the work that you do as a family caregiver and not being paid, and even as a paid caregiver, I feel like you're doing the work of nurses. And how much do nurses get paid? So how is that fair? And we're only going to be getting worse. A lot of our family members are getting older. We're getting into the baby boomer stage where there's going to be so many more people that we need to take care of. Caregiver, gochashan. So you're going to be taking care of 10 siblings or 10 relatives and get paid not even minimum wage, no leave. Ain't not yet, but it's very important. We're bringing this awareness to you. So ashon shebik itin tihiko. You know, again, you don't have to go to chapter house or run for council this year, since we have again election season, but it's really helpful if you talk with your own family about it. I bet you they don't even know how much you get paid. That's very important. And that's what we're fighting for. And I believe for 3 years now, isn't it, Pam? And we've gone to DC now again to bring up the National Domestic Workers Bill of Rights. That's bringing in again what we're talking about with the benefits, the wages and the leave. So aba ya just here e hot ya hot on Nielsen to be khanit jahoya. Ja holyaniki ya yo beto hoye to yo ya ba hansen chichago. Jodin shniki ya ben ko he che don ya masana shamata shaweta. So thank you so much again, and that's what I wanted to add, Pam.
Thank you. I appreciate that. It is, I think, a continuum to see that, you know, 50 years ago, we didn't have home and community-based services, but 100 years ago, people were living 30 years less than they are living now. And so now we're in this situation where 60% or more of people who are aging, who are elderly, said they want to stay at home. They don't want to go into a nursing home situation. We know that care provided at home is less expensive than care provided in the institutional setting. And yet here we are with less staff, less workers, less people able to do the job. And why would people choose this job unless they're your family members? Why would people choose a job with low pay, low benefits, hard work, you know, and all of that? And so there does need to be a shift, and we need to figure out a way to do that. And so the reason we're talking now about the care economy is that the more family members don't have a choice but to stay home and care for their loved ones, then that means they can't go to work. And so you end up in this situation. I think, Valerie, you mentioned something last week about, do I keep my job with benefits and good pay and all of that I worked so hard for, but my mother's really sick, and what am I going to do? I don't have other care. I'm going to quit my job to stay with my mom. That's what most people are going to do if they have that option. And so, but then that employer is looking for a person to replace you, right? And right now, finding labor is hard too. So that's where we're at now. And I just wanted to share one last slide, which is basically my information, my email, the New Mexico Caregivers in Action website, our Twitter, Facebook, and Instagram, if you want to see what's going on there. Also, I'm assuming since you made it to this training, a lot of you already know about the New Mexico Caregivers Coalition, so you already have their website. But in case you don't, I wanted to make sure you have that as well. And then Dana at nmcc.org is the way you reach Dana if you have any further questions for the caregivers coalition. And then, does anybody have any questions about the material that's been presented today? Questions or further comments? No? Okay, Ariana, thank you. And so I will return it then to Dana.
Thank you, Pam. That was really interesting. So I'm still kind of shocked at some of the information you shared. I guess I was not aware of the history of the home and community-based services. And it's been an interesting transition over the years of what kind of the services have gone through. Even just the language I noticed changed from decade to decade based on how they were referring to people and referring to the systems they were using. So thank you for that. I hope everyone learned as much as I did. I know most of you are used to me being the trainer, but this time I was one of the learners alongside you all. So it's been very, thank you, Pam.
You're welcome.
Like Pam mentioned, if anyone has questions at a later date, sometimes we know you don't think of them right away, and then you get off a training and then you're like, oh, I should have asked that question. Feel free to email me. Most of you should have my email address, dana@nmcc.org, since most of the reminders for trainings do come from my email. So feel free to email me any questions you may have. So yes, thank you all for coming. I always mention at the end of every training, you get certificates for all trainings that you attend with us at the New Mexico Caregivers Coalition, but they do get mailed out as a group. So for the month of May, any trainings that you attend in May, the certificates will go out sometime in June. So you get them all in a package in the next month for the previous month. But if there are no questions or any other further comments, Valerie, you want to say anything before we end today's session?
Oh, just thank you, everybody. And we're here to support you as caregivers, as you said, Pam, Dana, and I, Bridget, and we just appreciate you. So it is a wonderful history. It's your history because you are a caregiver. And that is where knowing more, they say knowledge is power. Yeah. So it's really good to The more you know, the better that you're informed, and you just talk about it with somebody, that we can make some really big changes. And like I said, I'm very excited that we met with 4, senator and representatives of the United States, and we got yeses. So this is very important to them. And you as a voter can keep that up, keep that going, and help that change. It has to take a village, and there's a lot of us that are out there. And as I said in my speech, I'm only one out of how many, and there's so many other stories out there that we need this help, especially on our tribal lands. We don't have that assistance. So that's part of it. And I just thank you, and so glad that you guys were willing and able to make it and learn. And like I said, we're all here to support you. And yeah, for coming. I love you guys. This is so great to be able to represent you all in DC, and I'm just super excited. So running for president, just kidding.
All right, well, I'm gonna let everyone go a little early. I feel like that's awesome because I feel like you guys are usually more patient with us and we're usually running overtime. So for once, you're gonna get some time back, but thank you all for joining us and we hope to see you in the next training.
Have a good day.
Have a good
Bye, thank you.